have you been moved towards voting for it by anything that Senator Reid or any other Democrat?
Well, in other words, as I said last night, I think we were having what I consider to be constructive discussions, and we're not. It's not finished yet. And I think one of the things we've learned in the hectic last couple of weeks is that we all ought to be looking at paper. This is a legislative process. We ought to be looking at specific legislative language before we say I agree or I object. But to be as explicit as I can be now, if, as appears to be happening, the so-called public option government-run insurance program is out, and the Medicare buy-in, which I thought would jeopardize Medicare, cost taxpayers billions of dollars over the long haul, increase our deficit, is out, and there's no other attempts to bring things like that in, then I'm going to be in a position where I can say, I'm getting toward that position where I can say what I've wanted to say all along, that I'm ready to vote for health care reform.
Can you explain your comments
on the Medicare buy-in?
Well, I didn't change my mind on the Medicare buy-in. I mean, I know this is a classic sort of sport here. Although it's not terrible to change one's mind if in fact you do. Look, here's the point. The Medicare buy-in as proposed didn't make sense. I mean, you can all focus on it, but it ended up, it seems to me, when advocates of the public option saw that they didn't have the votes for the public option, they kind of tried to get it down another path, and it made no sense. We've got a great health insurance reform bill here. And the danger was that some of my colleagues, I think, were just trying to load it up with too much. And what happens then is that you run the risk of losing everything. So I think what's beginning to emerge, though I know some people are not happy about it, is really a historic achievement. Healthcare reform such as we've not seen in this country for decades.